Hi, my name is Owen Hurley, and I'm discussing our paper today on biceps tenodesis for overhead athletes and rate of return to play. So our study looked at 44 patients who underwent biceps tenodesis in our institution and found that 82% were able to return to play, with 60% returning to their pre-injury level of play at an average of 8.7 months following their surgery. Additionally, among the 8 competitive athletes, those competing at college or professional level, there was a 87% rate of return to play. And overall, the VAS score was less than 2 on average in those returning to play. But the primary reason for not returning to play in those who didn't return was pain in 3 out of 8, with lifestyle change, changing interests in the majority of the others. So this is an interesting study to look at, as we wanted to look at our own population as biceps tenodesis becomes a more attractive alternative to slap repair, where there's been high rates of stiffness and the need for revision surgery. However, there's a lack of evidence in the literature for overhead athletes with concerns due to the non-anatomic nature. A recent systematic review in the journal found that there was only 99 patients reported in the literature who were overhead athletes that underwent biceps tenodesis. So we felt this is an area we needed to look at. Alongside our return to play measures, no patient ultimately underwent a revision surgery in this procedure or had a Popeye sign. However, looking at some of our overhead athletes who underwent a slap tear, there was approximately a 10 to 15% need for revision, while not looked at in the study in our own records from when we evaluated this. And I think it's important to note that as we move towards biceps tenodesis, it's starting to look at younger patients, overhead athletes, those populations where it is a promising alternative, but there's just a lack of evidence thus far.